Be 2 weeks ready. First Aid Plan, Activity 27. Follow along on Toolkit, page 85.
Activity 27. Practice your first aid skills. Goal: regularly put your skills to work. Practicing first aid skills will help you feel more confident if you need to care for injured or sick family members, friends, or neighbors. Practicing your skills is also the best way to keep your knowledge current and help you feel more comfortable when you need to render aid. Continue to find new ways to practice as you enhance your skills. T-shirt sling. If you, a family member, or a neighbor hurt your collarbone, shoulder, or arm and don't have access to emergency services, you can use a T-shirt as a sling. To practice this technique, put your head through the main hole of the T-shirt as if you were going to put it on. Then carefully slide the injured arm through the nearest sleeve and let the elasticity of the shirt brace the arm until you can access emergency services. Splint a finger. When a finger gets jammed or fractured, there are makeshift ways to brace it until you can get help. Practice by finding a popsicle stick or a twig or piece of metal and some tape. Hold the popsicle stick against the finger to keep it from bending and wrap a piece of tape around the top and bottom of the finger to hold the popsicle stick in place. If you don't have a popsicle stick to brace a finger, you can buddy tape it to the finger next to it. Wrap a piece of tape around the injured finger and its neighbor, both at the top and bottom of the fingers. Wrapping an ankle. Sprained ankles are common injuries. To wrap an ankle with an elastic bandage, position the injured foot at a 90-degree angle from the rest of the leg, or flex your foot. Begin to wrap the bandage near the bottom of the calf and make figure eights around the ankle for extra support. Emergency medical professionals recommend being comfortable with the following first aid skills. CPR, or cardiopulmonary resuscitation. CPR involves chest compressions and rescue breathing for someone whose heart has stopped pumping blood. The American Red Cross offers regular CPR training classes and provides a helpful step-by-step guide on how to perform CPR. First, call the emergency number. Second, check vital signs. Third, lift chin, check breathing. Fourth, give rescue breaths. Fifth, perform CPR. Sixth, repeat step 4 to 5 until help arrives. Conscious choking. There's a simple technique you can use to help force a trapped object from a conscious person's airway when they are choking. 1. Give 5 back blows. 2. Give 5 abdominal thrusts. 3. Repeat until the object is out. This should only be applied when the person is not coughing, unable to speak or breathe, and signaling for help, usually by holding their hands around their throat. You can even use a version of this technique on yourself. Severe bleeding. Severe bleeding can lead to death in as little as 5 minutes, so it's important to know how to stem blood loss. The Stop Bleed program, which can be found at www.stopthebleed.org, offers bleeding control training and teaches people 3 quick actions to control serious bleeding. One, apply pressure with hands. 2. Pack the wound and press. 3. Apply a tourniquet. Shock. Shock is a life-threatening condition that occurs when vital organs aren't getting enough oxygen. Treating shock involves keeping a person warm and comfortable until help arrives by loosening restrictive clothing, covering them with a coat or blanket, keeping the person still and on their back, reassuring the person, not giving the person anything to eat or drink. Wounds. Keeping wounds clean, even small ones, will help prevent infection. With clean hands, apply gentle pressure to a wound until it stops bleeding. Rinse the wound with clean water and apply an antibiotic cream or ointment. Minor scrapes or cuts may not require a bandage. For other wounds, you may need to apply a clean, sterile, non-stick bandage on the wound after cleaning it. Change the bandage at least once a day or when it's wet or dirty. For additional resources on this unit, visit OEM's B2WR Ready webpage.